small article, I don't know, to about one-fifth of one page in the front section of the USA Today. It says, study, statin drug side effects can be managed. Okay, and it says this article occurred, or actually came from Annals of Internal Medicine, and it's about statin drugs. And it says, despite their perceived benefits, some people stop taking them, citing fatigue, muscle pain, confusion, diabetes. One rare life-threatening side effect is rhabdomyolysis, which the muscles break down the pigment, the myoglobin, gets into the liver and kidneys and causes damage there. A 9-year study of 107,835 patients at Brigham and Women's Hospital in Boston, 11,124 had discontinued statins on their own because of side effects. Okay? Half started again at the lower dose or used different statin drug. 90% were still on it a year later. This is important news because the beneficial effects of statins, according to the lead author, Alexander Turkin, says there are potentially millions of patients who could take the statins again. Well, about 1 in 4 Americans 45 years of older are taking statin drugs. Okay? And the percentage of adults ages 45 and older whose use of statin drugs to lower cholesterol increased from 2% in 1988 to 25% in 2008. And they're talking about, and you have to go back here and say, no, wait a minute, what's this confusion thing? Oh, that's Alzheimer's disease. What's this diabetes thing? Oh, type 2 diabetes. Didn't the FDA come out with warnings that say, Houston, we have a problem because some of the side effects of statin drugs include Alzheimer's disease and type 2 diabetes. Now, we're talking about, we're talking about erectile dysfunction, low testosterone, adrenal exhaustion, kidney and liver disease, death, rhabdomyolysis, fibromyalgia, muscle pain of all kinds, Alzheimer's disease. And, of course, Alzheimer's disease is a physician-caused disease. Alzheimer's disease is, again, a physician-caused disease. Alzheimer's disease is a going away of the myelin, the white matter of the brain, the insulation material of the brain. It makes up 75% of the brain weight. And this myelin, the insulation material of the brain, the white matter of the brain that makes up 75% of the brain weight is 100%, you got it, cholesterol. So you go on a cholesterol-restricted diet, you're eating egg white omelets instead of whole egg omelets. You're eating egg beaters instead of eggs. You're eating boneless, skinless chicken breast instead of regular chicken. You're eating margarines and oils instead of butter and cream and lard. And then you're eating tofu instead of red meat. And then you're taking statin drugs to lower your cholesterol. Well, Alzheimer's disease didn't occur 42 years ago, even by another name. Today, it's the number 4 killer of adults over the age of 65. Now, by getting on a supplement program and living on high mineralized food, okay, we actually have a study that came out in 2004 which shows very clearly you can reduce your risk of Alzheimer's disease by 78 to 80%. Now, that's just with a couple of vitamins added to a diet that's locally grown on a highly mineralized soil. Well, what if you take all 90 essential nutrients? It'd probably be better than 78%. What if you eat 6 eggs a day instead of none? It'd certainly be better than 78%. What if you eat 4 to 6 eggs a day, take all 90 essential nutrients, stay away from the bad stuff, and then you throw in, maybe some high mineralized food? Well, the odds of you getting Alzheimer's disease would then be, 100%. You wouldn't get it. Okay, but remember, it didn't exist by another name before 42 years ago. So I urge everybody to get a hold of that book, Hell's Kitchen. Get a hold of the book, Hell's Kitchen. The subtitle is The Cause, Prevention, and Cure of Obesity, Type 2 Diabetes, and the Metabolic Syndrome, which is insulin resistance, which is obesity, and cardiovascular disease. And so what I want you to do is take, again, and I take 2 Healthy Start packs a month myself. I weigh 160, and so I take 2 Healthy Start packs per month, 1 full dose during the breakfast and dinner. I take 3 de-stress capsules twice a day. That's to ward off what's called Korsakoff syndrome, which looks like Alzheimer's disease, but is reversible in a week if you have it just by supplementing properly with 1 vitamin. And then Wernicke-Korsakoff's, which is Korsakoff syndrome, and the deficiency of that 1 vitamin, but it also has MS, multiple sclerosis, so I throw in our selenium to support and promote maintenance repair of the brain, help with the antioxidant power to resolve some of the lesions in there. And then in case it is Alzheimer's disease, they throw in 4 of the SMART effects 3 times a day. That's DHAs and EPAs, which are the raw materials for your brain to make neurotransmitters, particularly for memory and cognition and all that kind of stuff. Ultimate daily tablets, 3 of those twice a day, just in case it's vascular dementia, or prevent vascular dementia, prevent coronary artery disease, prevent kidney failure, because kidney failure is nothing wrong with the kidney. It has to do with plugging of the arteries in the kidney. And so these are things you can do. Now remember, I have not been to a doctor with me being the patient for 65 years, for the last 65 years. Never been sick. Never been on a prescription drug. Now, if everybody was like me in America, let's just talk about America for the moment. If everybody was like me, and they didn't go to a doctor but once in 65 years, the medical system would be real humble. They'd be like the old Maytag repairman, sitting in a chair, depressed, throwing playing cards into a hat because they have no business, because the Maytag washer and dryer are constructed so well that they don't need maintenance men. Well, if you take care of yourself with the 90 essential nutrients, stay away from the bad stuff, the odds of you needing a doctor is 0. Well, we'll be back with more Truth, Justice, and the Youngevity Way on Dead Doctors Don't Lie after these messages. Okay, Doug, what pearls of wisdom do you have for us today?
The secret is Greek tea.
Oh.
Or Greek coffee, that's it. Boiled Greek coffee. That's according to an ABC News article that I found here. And
is it Java Fit?
No, it's not. It's what I'm talking about here is an ABC News story where it's headlined, "Looking for answers in places where people live the longest." Well, they obviously already missed a boat because you've already done that. And they say researchers are looking for clues into leading a longer life in blue zones. And what they're talking about is there's a guy who wrote a book called Blue Zones, and he looked at census maps, he and other researchers, and marked out with a blue pen where they found centenarians, and they realized they were congregated into clusters, or as they called them, blue zones. So in addition to this Greek island that they focused this article on, Ikaria, is Corsica, Costa Rica, Southern California, and Japan. Of course, in Japan, they're speaking about Okinawa. And I was kind of surprised to find out that in Southern California, what they're talking about is Loma Linda.
Seventh-day Adventists.
And that's exactly right, which is something that you've often talked about in reference to Mormons, people that have a religious, part of their religion is to stay away from smoking and not drinking coffee and things like that, and they tend to live longer. So basically, this whole article vindicates you. Now, this article did center around this Greek island, Ikaria, and they said they found that they lived a life where they have a lot of physical activity because it's kind of a mountainous region, so they're walking up and down hills all the time. They eat a healthy diet, and later in the article they kind of referred to somewhat of a Mediterranean-type diet. And I did a little digging around about this Ikaria. I'd never heard of it before, and what I found, one of the things I found was a website where there's a woman who offers cooking classes. You travel to this island, and she teaches you in 4 or 5 days some of these Greek traditional foods and dishes. And in the course of her website, she says, we teach you how to use the traditional wood-fired oven. So there you have the wood factor. As you found out that most of these long-lived cultures still cook their food with wood, and they take that wood ash and they put it into their gardens. And another thing they talked about as far as this Greek island Ikaria, they say they eat a diet of fresh vegetables, fresh fish, and of course cooking a lot of that food in these wood-fired ovens. And
what do they fertilize their little vegetable garden with?
More likely than not, the ash from the wood ovens.
Well,
and
there you go.
Also, one of the tourist destination spots on this island also is hot spring spas, and usually hot springs are mineral water, so they're probably drinking that same mineral water and getting it in their, putting that on their gardens, so they're getting their minerals that way. But once again, nowhere in this article did they mention at all any mention of nutritional supplementation or getting minerals into your diet somehow.
Well, exactly right. This is the top 20 longevity cultures on Earth are third world cultures. They do not have utilities, no electricity, propane, or natural gas. The universal fuel is wood. And by dumb luck, Doug, and you hit the nail right on the head, by dumb luck, their vegetables and corn and wheat and stuff like that they grow, and their vegetables and their squash and tomatoes and sweet potatoes and so on, are grown in soil that has more than 40, 50, 60 minerals in it. So the wood ashes then goes into the garden. Wood ashes are plant minerals. They get their mineral supplements by eating these vegetables. Well, when they turned on the electricity in 1882 for us, guess what? The wood ashes source went away. No more wood. Thank you for bringing that one up. That's a great one. We'll be back after these messages. Okay, Doug, let's go to callers.
Let's head to Maryland. And Carmen, you're on with Dr. Wallach.
Hello, Carmen. You're on the air.
Hi, Dr. Wallach. I called you about my dad who was losing weight, and you gave me this thing to give him, and I've given him the cream with the shake every day, and he's gaining weight, but he's sweating a lot now. And I used to give him water all the time, but because of what I heard that you said to give them beyond,
Well, you
rebound.
want to give him, rebound.
Well, I don't give him any water now, and he sweats so much. He's dehydrated for the last 3 days. I'm giving him water now because I don't know what to do about him.
Okay, now you must listen to the words carefully. Stop. I didn't say don't give people water, but if you're going to give them, people have to have water. What you do is you add the rebound to their drinking water, which then puts 100 nutrients in the water. If you give them only water without the mineral source, sweat is not water. Sweat is a soup that contains all the nutrients floating around your blood. And so you're out there sweating, and you're just drinking water, you're getting into the negative, you're going to be in real trouble. And so what you do is you just add the rebound as a powder, or you can get the liquid concentrate and add it to the drinking water. Don't not give somebody water. Good grief, woman.
Plus the shake, but I wasn't giving him water also.
No, you must give him water also. The shake is not a source of water because you're making it with heavy whipping cream.
So give him the rebound and water.
You have a rebound in the water, and then the shake made from whipping cream. That's two separate things.
I know, but I was giving him water and rebound in a bottle. So he was drinking 3 or 4 bottles before, and I thought you had to cut out all the water and just give him rebound in bottles.
No.
Okay. And then the other thing is I'm stressing out over him because he can't stand it all now. He's gaining weight, but he's like a rubber band.
Yeah, okay, now stop. Is he taking the complete Healthy Start pack?
I'm putting everything in there, that shake.
Okay, now wait a minute. Is he taking the Beyond Tangerine?
Yes.
Is he taking the Osteo FX Plus?
Yes.
Okay. And
he's
taking
the stress in there.
Yep.
And 2 eggs.
Okay.
And the heavy whipping cream.
Okay.
And the Osteo FX and the EFAs.
Yeah, that's fine. And then you can put it in the freezer or have him eat it with a spoon or drink it, whatever. But he still needs water and some rebound. Put the rebound in the drinking water. Yeah, he needs water. You got to give people water. He's got to have 8 glasses of water a day. Don't not take water. You just have to make sure you get the rebound with it. So because when you're sweating out of soup, not just water. It's add to, not detract from. You better call me every day for a while. We'll be back after these messages.
Let's head to North Carolina. And Sonia, you're on with Dr. Wallach.
Hello, Sonia, you're on the air.
Hey there.
How can I help you?
I have, in the last 5 years, been diagnosed with 3 different autoimmune diseases. I've also struggled with depression and anxiety for...
Okay, well, stop.
Okay.
You say some pretty heavy things there, and you moved on without explaining. What 3 autoimmune diseases do you have?
Hashimoto's, fibromyalgia, and Sjogren's.
Okay, well, none of those are autoimmune diseases. Okay, so that should give you some relief. Okay. Hashimoto's a thyroid disease, which is not autoimmune. Fibromyalgia is a simple multiple mineral deficiency, and it has a component to it that is a malabsorption thing, usually gluten intolerance. And then Sjogren's disease is caused by osteoporosis of the skull. It's kind of a variation on Bell's palsy. Instead of your face sagging, the parts of the seventh cranial nerve, the facial nerve, that control the tears in the eyes and the saliva in the mouth get squeezed, and they stop producing tears and saliva. Okay? So you can be comfortable that nothing you have here is a autoimmune disease. In fact, there is no such thing as autoimmune disease except when a kid is born with no immune system. Okay? Whoever told you that stuff should have their license taken away for something. I don't know, reckless endangerment, insurance fraud, whatever. You don't have those diseases. Okay, so we got that out of the way. What else do you got?
Renal tubular acidosis.
Okay, now you have acidosis. Why do you have acidosis? Are you starving yourself to death?
I got my first kidney stone in 2007, and they did a test, and that's what they came back saying that I had. And I've been taking potassium ever since.
Okay, kidney stones are caused by calcium deficiencies. There's another deficiency disease. Kidney stones are always, 100% of the time, caused by raging osteoporosis. I've written many scientific papers on it. I've done autopsies on hundreds of people and thousands of animals that have kidney stones, and it's always an osteoporosis calcium deficiency. So you've been going to the wrong group of people, okay, giving you misinformation. What do you weigh here, Sonia?
About 135.
Okay, and how tall are you?
5'4".
Okay, and how old are you?
42.
Okay. Do you have any children?
No.
I'm sorry?
No.
No? Is that a no?
No kids.
Okay. Have you had miscarriages?
No.
Okay. Never been pregnant?
No. I've actually had a hysterectomy.
Ah, okay. Now, do you have a history of anything like irritable bowel syndrome or inflammatory bowel disease, constipation, diarrhea, anything like that?
Yes.
Which one, or all?
I got diagnosed with irritable bowel a long time ago, but...
How did I know that?
Huh?
How did I know that?
I don't know. That's just what they told me.
Well, I'm going to tell you after this break. You hang on, dear. I have solved your problems already in less than 2 minutes of questioning. I want to find out when we come back how many years you went to doctors, how many doctors you went to, and how many medications you were on. We'll be back after these messages. Okay, Doug, let's go right back to North Carolina. And Sonia. Okay, well, basically, I'm going to set you free here, young lady. Number one, you have to give up all gluten. No wheat, barley, rye, or oats. I'd urge you to get a hold of that CD called Cereal Killers because gluten is hidden in everything. People think, well, I gave up bread. That's not enough because it's in everything. They use breadcrumbs and cracker crumbs for meatballs and meatloaf. They use wheat flour to thicken tomato soup. All the sausage-type meats, the filler is wheat flour. There's wheat in yogurt. There's wheat in ice cream. There's wheat in everything. Okay, chocolate milk, for instance. They use it to thicken everything. In fact, rye is used as a extender for coffee and tea because it's so expensive now. They're actually using rye flour as an extender. And so if you have a gluten intolerance, you cannot have wheat, barley, rye, and oats. You have to change your eating habits and drinking habits and so on. So I want you to get a hold of that CD, Cereal Killers. I want you to get a hold of the book Hell's Kitchen because there's a nice big section in there on gluten intolerance. And then I would like you to get rid of all the fried foods out of your life, all the processed meats with nitrates and nitrites, no oils. It means no margarines, mayonnaise, salad dressings, cooking oils. If you eat canned fish, they got to be packed in water, mustard, tomato sauce, not oil. And then I want you to take, looking at all this stuff here, I want you to take one healthy bone and joint pack per month. Cut it in half. That'll be a tablespoon, which is a half ounce, of the Osteo FX Plus at breakfast and dinner. I want you to take one scoop of the Beyond Tangerine NutriCrystals at breakfast and dinner. The 3 EFA Plus is designated for 1 day, one at breakfast, lunch, and dinner. And then you're also going to have one large bottle of the glucogel. Okay, I want you to take 5 glucogels 3 times a day, but you won't be able to do that with one bottle, so I want you to get an extra bottle of the glucogel. That'll allow you to have 15 glucogel capsules a day, 5 at breakfast, lunch, and dinner. I'll tell you about that in a second. And then I want you to get an extra quart of the OsteoX Plus because I want you to take an ounce at bedtime with a glass of water because you have raging osteoporosis. Okay, now this will also help support and promote maintenance, repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, bone itself, because Sjogren's disease, remember, is a manifestation of Bell's palsy which is caused by osteoporosis of the skull squeezing the roots of the seventh cranial facial nerve. Fibromyalgia is a disease of, it's almost like lupus. It's kind of a cousin to lupus. And so in addition to the one Healthy Start pack, the extra bottle of the glucogel, the extra quart of Osteox Plus, I also want you to get 2 bottles of selenium a day. I want you to take 3 of those twice a day. That's going to help support and promote muscle health for the fibromyalgia. And because you have the thyroid problem, you also need to give up cruciferous vegetables, cabbage, broccoli, cauliflower, Brussels sprouts, kale, because they interfere with thyroid metabolism. And then lastly, for the thyroid, I'd have you take what we call Ocean's Gold. I want you to take 2 of those tablets twice a day. That's 1 bottle a month of Ocean's Gold. Call me every 2 weeks. I want to know your weight. I want to know things like muscle pain, joint range of motion. I want energy, how well you sleep, and all that kind of stuff. You're going to be a new woman here. And by getting rid of the gluten, you're going to deal with the IBS, your bowel syndrome. If you have any brothers and sisters, they got to get on the same diet. If your mom's still alive, she's got to get on the same diet because she gave it to you and all your brothers and sisters, and so on. And if you have, well, you don't have any children, but if you have brothers and sisters who have children, the girls have passed it on to their kids, and so they have to get on a gluten-free diet and all the 90 essential nutrients. Their kids have to get on it. Failing to do this, they will lose something like 25 to 50 years of their life, and what life they do have is going to be nothing but misery. You've suffered terribly all these years without necessity here. I'm going to ask you one question. Actually, it's a 2-part question, but it's one question. How many years did you go to doctors with all this stuff and nobody told you about gluten intolerance and the 90 essential nutrients? How many years and how many doctors?
6 doctors.
30 years?
6 doctors in probably the last 12 years.
Yes, okay. See, they should all be put in jail because you suffered here egregiously, unnecessarily, for nothing for 30 years. You'll resolve this in 90 days. You're going to be a new woman. And what I want you to do is be my poster girl here. Okay, so I want you to call me every 2 weeks. Give me a progress report or a lack of progress report. We're going to walk you through this. We're going to make sure everything works for you. And then I want you, like I say, to be a poster girl, and I want you to be sure to share all your information with everybody. And we want you to make sure that everybody in America knows your story. We'll be back after these messages. Okay, so, Doug, let's go to callers.
Well, let's head to South Carolina. And Jim, you're on with Dr. Wallach.
South Carolina and Jim. Jim, you're on the air.
Hello, Dr. Wallach.
Yes, sir. What's up?
I got a fella that got bad arthritis in his shoulder, and he's kind of limited financial means. I want to know the one best product that I could start him off on that could help him.
Okay, the one best product, I'd give him what we call Ultimate Classic. Ultimate Classic, but I would throw in one more thing, and that would be the EFAs or the EFA Pluses. What does he weigh?
About 155.
Ideally, he should have 2 quarts of Ultimate Classic per month. It'd be 1 serving of, it'd be 1 ounce of the Ultimate Classic at breakfast and dinner. He would also take 3 of the EFAs a day or 3 of the EFA Pluses a day. And if that's too much for him, just 1 bottle of Ultimate Classic. I'd divide it in half, a half a dose, which would be a half ounce at breakfast and dinner, and the 3 EFAs a day. That's going to give him all 90 essential nutrients in optimal amounts. And that would be the most conservative way you could get it done would be the Ultimate Classic and the EFAs. You'll be giving him everything he needs to fulfill his requirements for the 90 essential nutrients, okay?
Okay, next question. I have a lady, 49 years old, 5 foot 6 inches tall, and weighs 150 pounds. She just finished about 6 or 8 months of chemo and radiation for breast cancer. And she's been diagnosed last few days with inward goiter of the thyroid. What can help her?
Okay, goiter of the thyroid, okay. Yeah, so what I would do, 150 pounds, she has a history of breast cancer. Again, ideally, well, let's do it this way. I'd have her take 1 Healthy Start pack per month, and I'd have her take 1 full dose of everything at breakfast. Okay, 1 full dose of everything at breakfast. Then I'd get her also a quart of the Ultimate Classic, and I'd give her an ounce at dinner time. And then because of the goiter, I would give her the Ocean's Gold, 2 tablets twice a day, as 1 bottle a month. And she has to stay away from fried foods, processed meats with nitrates and nitrites, no oils, no gluten, and absolutely no cruciferous vegetables. That means no cabbage, broccoli, cauliflower, Brussels sprouts, and kale. Okay, and that's going to cover her needs for, supporting her immune system. And this is kind of wild, but amazing. If I didn't say it, she needs, for breast cancer also, I would throw in the selenium. I'd give her 3 of those twice a day, 2 bottles a month. Okay, we'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Young Giving and 90 for Life Crusade. And Doug, let's go to callers.
Let's head to Salisbury, Maryland. And Barbara, you're on with Dr. Wallach.
Hello, Barbara. You're on the air.
Hi, how are you doing?
Fine, thank you. How can I help you today?
All right. Dr. Wallach, I was diagnosed with autoimmune disorder, and I just heard you speak to the other lady, and as a result, I was diagnosed with rheumatoid arthritis.
Okay, that's not an autoimmune disease. It's actually an infection with a bug called mycoplasma. Mm-hmm. And when were you diagnosed with rheumatoid arthritis?
I was diagnosed about 4 years ago.
Mm-hmm. And did you get methotrexate,
yes,
Remicade, and all that stuff?
I started off with one drug, and so I went with that. I went to Baltimore, and they placed me on methotrexate. So I take 6 tablets once per week. And even in taking that, my hands are still sore.
Okay. Yeah, okay, they're trying to give you some inflammation relief and pain relief. They're not really addressing the cause of the disease.
Right.
If a doctor cures you, which is rheumatoid arthritis is curable. If a doctor cures you for rheumatoid arthritis, he's going to make $300 of in office calls. If he treats you for 25 years, he makes $750,000 from your insurance company.
Okay.
You understand the problem here?
I certainly do.
Okay. Yeah, you're being used as an ATM machine. So here we go. What do you weigh, dear?
Better. I weigh 276.
Okay, and how tall are you?
I'm about 5'6".
Okay. All right. Yeah, 5'6", I'd like to see you weigh, 145, 150, somewhere in there, right?
That would be great.
Okay, we can do it. All right. Now, again, rheumatoid arthritis is an infection with a bug called mycoplasma. This is no secret. Every medical school knows it. They all do research on it. They know how to kill it in 2 weeks. And then it takes 60, 90 days to repair all the damage that the bug did. And after 90 days, you're home free. If you had it for years and years and years, you're all deformed. It might take 6 months to a year to straighten out all the fingers, but that's doable too. You can play the piano after 6 months, right? So, but nobody should be treated for rheumatoid arthritis for so many years of their life when you can kill it, you can get rid of it in 2 weeks. So here we go. I need you to get rid of all the bad stuff that's causing and contributing to inflammation. I need to ask you, do you have any skin problems, any eczema, dermatitis, psoriasis, or rosacea?
I have alopecia.
Alopecia, okay.
I have alopecia, and I also have vitiligo.
Okay, you lost the skin color. Yep, I know it.
Yeah, and so it's not all over my body, but it's preferably small spots on my thighs. Mm-hmm. And I also had tumors on my thyroid. I had half of my thyroid taken out in August.
Okay, they surgically remove your thyroid?
Yes, so they took
half
of it out.
Okay, so you're on what, Synthroid? You're on Synthroid or U.S. Armor Thyroid?
I'm not on anything. I'm not on anything for that.
They didn't give you anything to replace your thyroid?
No.
That means they left some of it. They left some of it in there.
Right, they took the thyroid out on the left-hand side.
Oh, okay.
But they left the right side intact.
Okay. All right, well, here we go. So I want you to get rid of all the bad stuff, okay? No fried foods, no processed meats with nitrates and nitrites. That means things like deli slices, sandwich meat, sausage, ham, bacon, bologna, salami, pastrami, no Subway sandwiches, no Quiznos, no hot dogs, all that stuff's got to go. No oils, it means no margarines, mayonnaise, salad dressings, cooking oils, absolutely. If you eat canned fish, you got to be packed in water, mustard, tomato sauce, not oil. No gluten, no wheat, barley, rye, and oats. no gluten, no wheat, barley, rye, or oats. I want you to start shopping in the gluten-free aisles. If you like to cook, we have what we call Valerie's Gluten-Free Cookbook, and it's just tremendous. You use a lot of Youngevity products in the recipes, and so you need to be thinking in those terms. And I want you to get a hold of that CD called Serial Killers. It tells you all the hidden places that you'll find gluten so you don't accidentally run into it. And then, because of our weight challenge here, I want you to get a hold of the book Hell's Kitchen. The subtitle is The Cause, Prevention, and Cure of Obesity, Type 2 Diabetes, and the Metabolic Syndrome. Do you have diabetes?
I don't have diabetes.
Okay, good girl. All right, well, here we go. The supplement program is going to be three healthy blood sugar packs per month. I want you to take 9 kilobiotics a day, and I want you to take in 15 glucogel a day, and then call me in 2 weeks. Okay, well, thank you, everybody. Great questions and testimonies today. Want you to appreciate that Doug and Billy do a great job, for a superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.
Hi everyone, Andy Anderson here. Are you using those handy little bottles of gel that zap germs, bacteria, and other nasties? In today's world, that's smart, especially with all the filthy doorknobs, shopping carts, and handrails we touch every day. Here's what you may not know. Once the alcohol evaporates, goodbye effectiveness. No more protection until you use it again. PureWorks to the rescue. Our FDA-compliant foam, lotion, soap, and spray do not rely on alcohol. Their killing power lasts up to 4 hours. PureWorks disinfecting spray is EPA certified to kill swine flu, bird flu, MRSA, HIV, hepatitis B and C, and a whole host of viruses and bacteria. Mold and fungus too. It's even safe around children and pets. You'll love the soft feel of PureWorks on your hand. It actually conditions and will not dry your skin. Here's a little peace of mind knowing your hands are still germ-free hours later. Get your hands on PureWorks and get PureWorks on your hands. Stand by. Pull out your paper and pencil for your local number to order PureWorks.
According to the CDC, nearly half of all Americans take at least one prescription drug daily. For those over the age of 60, almost 40% are taking at least 5 medications every day, some of those drugs costing hundreds of dollars. Most people struggle to pay for these expensive drugs, but FDI Youngevity has the answer with discount pharmacy cards. You can get a 10% and on some drugs up to an 85% discount, up to a 35% discount on hearing aids, and up to a 60% discount on lab tests, even ones for your pets. This card never expires, and best of all, the FDI Youngevity card is free. That's right, I said free. Imagine the change in your life with extra change in your pocket. All because you're saving hundreds, if not thousands, on your medical costs with your FDI Youngevity discount card. Contact your local FDI Youngevity associate and find out how you could get your free pharmacy discount card. And remember, it's free!
If you've been diagnosed with type 2 diabetes, prediabetes, or the metabolic syndrome, and you're tired of seeing your blood glucose levels rise and fall like a ship on the ocean, but you don't want to take those drugs the rest of your life, Youngevity has an alternative. A product called Sweeties has been developed just for you. Used as part of your regular diet, Sweeties helps maintain healthy blood sugar levels. A formulation specially designed to nutritionally assist your body with the regulation of your blood sugar level. Sweeties supports healthy glucose metabolism because it's fortified with aspartic acid, chromium, and vanadium, all to help you promote healthy blood sugar levels. If you want to get off those drugs and control your blood sugar metabolism naturally, try Youngevity's Sweeties product. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. You may have heard about the 90 essential nutrients or the mighty 90 needed for good health. But with all the products out there, what exactly are they talking about? The Mighty 90 is 16 vitamins, 12 amino acids, 60 plant-derived minerals, and 2 essential fatty acids. So now you know. But with all the products you see and hear advertised, what exactly do you buy to come up with the Mighty 90 and the right ratios to promote good health? Youngevity has made it easy with the Healthy Start Pack, which contains 1 canister of Beyond Tangy Tangerine vitamin and plant-derived mineral complex, 1 bottle of Bone and Joint Enriching OsteoFX Plus, and 1 bottle of EFA Plus Essential Fatty Acids, all in the proper ratios to promote good health and vitality. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
In recent years, several studies have discovered the health benefits of drinking coffee. Youngevity has now taken it a step further with an entire product line of healthy coffees from Youngevity's JavaFit selection of top-shelf gourmet coffees. All JavaFit coffees are made from 100% premium hand-selected Arequipa coffee beans grown in the finest regions of Latin America, all carefully roasted, creating a delicious, rich, full-bodied flavor. Try JavaFit's Immune Plus, a full, robust coffee blend combined with the immune-supporting benefits of echinacea and the full-spectrum daily requirement of vitamins and minerals. Boost your immune system every day with JavaFit's Immune Plus multivitamin coffee. Available in 30-count single cup or 24-count single pot packs. Contact your local Youngevity distributor to get Javalution coffees. And don't forget to ask about the home-based business opportunity.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
I am Judy DeVilbus. Here I am speaking to you again. I just wanted to tell you that recently I started drinking the Whey Shakes again, the chocolate Whey Shake. And you need to remember, the Whey Shake isn't just for losing weight. It's a fantastic place to get your great protein. And if you're trying to gain weight, you can take it along with your meals. And the best part is, if you want to just have a great protein shake, do like I do. Put it over ice, stir it up, and you can sip on it for 20 minutes to an hour. I do it every single day. I absolutely love it. You need to get back to it too. It's really good for you. And it makes not fat, but it makes muscle after you work out. And you can also mix it up in a blender with an egg, and you have the most incredible health protein shake. Or mix it with a little water, stir it up, and you have a little pudding. And who doesn't like pudding?
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
Hi, this is Dr. Joel Wallach, your host of Dead Doctors Don't Lie. If you're interested in a colon cleanse, blood cleanse, liver cleanse, in the classical herbal way, you want to ask your longevity associate for Herbal Rainforest. Herbal Rainforest has 16 herbs, 16 cleansing herbs, classic cleansing herbs, and 77 plant minerals. That's right, and these are all organic. It doesn't get any better than that. In your busy day, and you're around all these toxins out there in your workplace, on the way home, going to work, in your food, in the air, in the water, you need Herbal Rainforest. I guarantee you, it will give you a cleanse. You can control the dose. It's a liquid. It tastes good. It doesn't get any better than this. A colon that's happy makes you happy. Nothing better than a happy colon. Herbal Rainforest. Clean it out.
For more information on this product or others you've heard about on the Dead Doctors Don't Lie radio program, call your local longevity associate today. And don't forget to ask about home-based business opportunities.
Greetings, everyone. Judy DeVilbus here. What do you think of when you hear the words tangy tangerine? Well, I think of like a sweet, tangy tasting something. Well, what I'm referring to is the Ultimate Tangy Tangerine. It's a fantastic product. It has everything you need, and a great benefit is it's very, very delicious. It's very easy to drink. I've suggested it even to youngsters. Even children like it. Even little guys. Even little girls. They come right into my office. Their parents can't get them to take those chewable, and besides that, they're not as good as tangy tangerine. And I give them a little taste of that, and you know something? They're pleased as punch. So, if it's good for a child and it tastes delicious, why not you? There's no excuse not to take a vitamin when it tastes as good as that does. So how about it? Tangy tangerine should be the answer to all of your nutritional program problems.
For more information or to order, call your longevity distributor today. And don't forget to ask about longevity home-based business opportunities. If you're up several times every night to go to the bathroom, have frequent urination during the day, feel like you have to urinate but then have difficulty getting a stream going, have leaking, dribbling, or urgency to the point a restroom must always be nearby, you may have an enlarged prostate. According to the National Kidney Foundation, by age 60, more than half of all men have an enlarged prostate, or BPH. By age 85, that number is 90%. According to the American Urological Association. Ultimate ProstFX from Longevity has been developed for nutritional support of the prostate gland. ProstFX promotes prostate health and supports healthy prostate function. Stop sprinting to the restroom and avoid those embarrassing moments with ProstFX from Longevity. If you'd like to learn more about nutritional supplementation, call your local Longevity associate and don't forget to ask about home-based business opportunities.
Through his research as a veterinarian, Dr. Joel Wallach discovered that most health problems afflicting livestock can be prevented and even reversed. Many of these same health challenges also occur in humans. These too can be prevented and reversed. Doc's original formula, called the pig arthritis formula, alleviated all arthritis symptoms in animals. The same basic formula has been developed for humans, called the Pig Pack, which includes plant-derived minerals, a multiple vitamin complex, glucogel, and EFAs. Add to that Longevity's OsteoFX Plus, a proprietary blend of liquid calcium, magnesium, and glucosamine. Now you have the Pig Pack Plus to make up the 90 essential nutrients Dr. Wallach has identified as necessary for sustained good health and longevity. If you'd like to learn more about nutritional supplementation, call your local Longevity associate, and don't forget to ask about home-based business opportunities.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Longevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Longevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. 313-444-3463. Call now to change your life. That's 313-444-3463.